Hello, good morning everyone. Welcome back to my YouTube channel. So in this video, we just discuss about the anatomical position. Okay, why is it important? Okay, it helps to localize the muscles, bone, or a joint, or any kind of different types of organ. Okay, so it can help to study purpose. Okay, so this is a basic term you can easily understand, or this is very important to further study. Okay, so let's start the video. So first we discuss the what is anatomical position. Okay, so the anatomical position is the standard reference position used in anatomy to describe the location and relation of body parts. Okay, it serves as the universal reference point. All anatomical terms like anterior, posterior, medial, lateral, proximal, distal are described with respect to this position. Okay, so you discuss one by one. Okay, so first we discuss the position of body. Okay, so first is anterior and posterior. Okay, so anterior means, A for anterior means आगे वाला portion, P for posterior means पीछे वाला portion. Okay, anterior means towards the front of your body like face, chest. Okay, and posterior means towards the back of your body like spine. Okay, next we continue with next term. Okay, so we discuss the superior or inferior or cranial or caudal. Okay, superior means upper part of your body, inferior means lower part of your body, cranial means refers to the head end, or caudal means refers to the tail end. You can easily understand with diagram. Okay, suppose this is a body. Okay, so if you go upper side of your body is called superior, if you go down, so this is called inferior. If you talking about the head end is called your cranial. If you talking about the lower end, okay, so this is called caudal. Okay, I hope you can understand easily. So now we go for next point. Okay, so next is medial or lateral. Okay, you can easily understand by the diagram or by me. Okay, so median, this is your midline. Okay, if your movement towards your midline is called medial. Okay, or if your movement is away from your midline, so this is lateral. So this kind of movement is lateral, or this kind of movement is medial. Okay, I hope you can easily understand. Okay, as look in a diagram also. Okay, so next we continue with next part. Next part is proximal and distal. Okay, proximal means towards or nearest the trunk or the point of origin of the part. Okay, distal means away from or farthest from the trunk or the point of origin of the part. Okay, you can easily understand what is proximal and what is distal. Okay, suppose this is your upper extremities. Okay, this is your trunk part. Okay, if you move like this, so this is nearby your trunk, right? So this is your proximal part, or this is your distal part. Okay, for as well as leg, this is common things. Okay, you can easily understand with by the diagram also. So in here, this is your proximal part, this is your distal part. For your leg, this is your nearby trunk, so this is proximal part, or this is your distal part. Okay, so now I give you one small question, you just comment in video. Okay, so this is your one question. Okay, suppose you are going to the clinical duty. Okay, so you can just read the file of patient, and in the file of patient written distal part of radial will be fractured. Okay, so this is your radial bone. Okay, so distal part of radial will be fractured. So here is fracture or here is fracture, you can just say. Okay, so in video we just say if you move like this part is just nearby your trunk, so this is your proximal or this is your distal. For the your radial bone, this is your proximal part or this is your distal part. It means patient having some fracture from this area. Okay, so I hope you can just understand what is proximal or what is distal. Okay, so now we go to the next slide. Okay, so as you can see the image and you can easily understand these basic things I just mind up. Okay, so if you move like this just towards the trunk, okay, so this is proximal. If you move away from the trunk is called distal. For hand also, if you move like this is distal, or if you move like this is proximal, right? So if you move away or upper part of your body is superior, if you move down, so this is inferior. Okay, so this is your front part of your body is anterior, or this is your back part of your body, so this is posterior part. Okay, so I hope you can easily understand this basic anatomical term. Okay, so now we go to the next slide. So next slide is unilateral or bilateral. Okay, unilateral means you just focus on one side. Uni means one. Okay, bi means two, so you can focus on both side. Okay, so now we discuss the superficial, intermediate or deep. You can just easily understand outer surface of the body is a superficial, or in between you just say intermediate, or deep just inside. Okay, suppose this is the layer of a skin, or any body or any muscles. Okay, so you just focus on the upper part, so this is a superficial. If you focus on the middle part, then you called intermediate, or if you focused on the inner part, so you can just call deep. Okay, so you can easily understand that what is superficial part, intermediate part or deep part. Okay, so now we're going to the next slide. Okay, so our next slide is body planes. Okay, there are mainly four body planes. Okay, so first is sagittal, second is mid sagittal, or third is frontal or coronal, fourth is transverse or horizontal plane. Okay, so now we discuss one by one. Okay, so first is sagittal plane. Okay, so sagittal plane means divide your body into right and left part. Okay, or mid sagittal or median means divide your body into two equal parts. You can easily understand by me. Okay, so sagittal means if your body is divided into left and right. Median means if your body is divided into two equal part. Okay, so if your body is divided from here, then your body is divided into two equal parts. But if your body is divided into from here, okay, so this is your left part, this is your right part, so this is sagittal. Okay, but if your body equal divide, then you call this is your median plane cut. Okay, this is a very imaginary line, don't want to cut in your organism. Okay, so next we continue with next plane. So next plane is frontal or coronal plane. This is very important. Okay, coronal plane means if your body divided into anterior and posterior, like if you just imaginary cut from here. Okay, so if you cut like this, okay, or if you suppose this is your uh, anybody, if you cut like this, so this is your anterior or this is your posterior part, so this plane is known as a coronal plane or a frontal plane. Okay, so now we discuss the next part, as you also seen in image. Okay, so now we discuss the transverse or horizontal section of plane. Okay, so if your body divided into upper and lower part, as you can see in image, so this is a transverse plane. Okay, so now we discuss the different term of movement. Okay, what is flexion, what is extension. Okay, as you can see the image and as you can see me. Okay, if you move like this is flexion, this is extension, this is flexion, this is extension, means your body natural movement. Okay, or if your angle is decrease is flexion, in extension angle will be increase. MCQ based question. Okay, you just remember for your finger. Okay, for your palm, your movement mostly from like this, na, not like this. Okay, so if you move like this is flexion, or if you move like this is extension. Okay, I hope you can easily understand basic anatomical term. Okay, so now we just see the flexion extension of different body parts. Okay, so now we discuss the abduction and adduction. Abduction means if your movement away from your midline. Okay, so this is your abduction. If your movement is towards your midline, okay, so this is adduction, or away means abduction. Okay, so you can easily see the image, and you can easily understand abduction and adduction. Okay, so now we discuss the supination or pronation. Okay, supination means if you move laterally. Okay, suppose this is a shop, very small, but you can easily understand. Okay, so if you, this is your shop, if you hold like this. Okay, if you hold like this and movement is your like this, so this is your midline. Okay, if you move like this, so you move medially. Okay, hold the medially, hold the soap or anything in your palm, so this is pronation. Okay, if you move like this is towards the lateral, towards the or away from the body. Okay, so if you move laterally or laterally hold the soap or anything in your palm laterally, so this is called supination, or this is medially you can hold, so this is called pronation. This is a basic or important question, you can just easily understand. Okay, supination means laterally hold the soap, pronation means medially pour the soap or hold the soap. Okay, so I hope you can just easily understand. Okay, so now we continue with next topic. This is plantar flexion or dorsiflexion. Okay, plantar flexion just seen in the from with the help of ankle joint, right? So if your foot is moved away from the body, so this is plantar reflex. If you move inner of your body like this is called dorsiflexion. Okay, so as you can read, plantar flexion means foot क्या है, point toes or foot downward like this is called plantar flexion, or if your foot or toes move upward is called dorsiflexion. Okay, so this is very easily understandable. Okay, so now we discuss the next topic, that is inversion and eversion. Okay, inversion and eversion. If you suppose this is your leg. Okay, this is your toes. Okay, if you move towards your midline or towards your body, so this is inversion. If you move like this is called your eversion, as you can see in image. Okay, so now we discuss the next part. So this is medial and lateral, we already read na. Then we discuss about the protraction and retraction, very important. Okay, so you can easily understand. Protraction means if your movement is away from, okay, for your scapula. Okay, so I can show you. Okay, so if you move like this na, if you bend like this, so scapula will be expand like this, so this is protraction. But if you move like this, if you move like this, like this, okay, so your scapula will be nearby each other. Okay, so this is called retraction. I hope you can easily understand. Okay, so now we discuss the next part. Okay, next part is circumduction. Most of the people, just a small confusion in there, what is circumduction or rotation, maybe similar. Okay, no yaar, circumduction means if you move and making a circle. Okay, like this, if you move like this is called circumduction. But if you move like suppose if you move like this, okay, this is rotation. But if you move like this, okay, this is circumduction. I hope you can easily understand. Okay, so now uh, finish the video. So thanks for watching my video, and please subscribe my YouTube channel. If you have any doubts, please comment on my video, and if you want to make a video as you want, or okay, then you can comment your topic. I make a new video on your topic. So now हंसते रहिए, मुस्कुराते रहिए, तब तक के लिए हैव अ नाइस डे।